The new year is just 2 days away, so we're looking at the stories and trends that will define the year to come in our series, What's New in 22. This morning, we're focusing on health, especially the coronavirus. In 2021, more than 605 million COVID vaccines were given out in the U.S. Also, the FDA authorized emergency use of 2 new COVID antiviral pills. Chief Medical Correspondent and the man with the master plan, Dr. Jon LaPook, joins us right now. What to expect in 2022 in the fight against COVID. John, how are you doing this morning?
How you doing, Nate? Big hello this morning. I gave you a little too short one the other day from Vermont.
I appreciate that. Thank you so much. Now, let's get right to it. How can these antiviral pills help with the fight against COVID?
Well, this is kind of a big deal, right? The Paxlovid is from Pfizer, and Molnupiravir is from Merck. Paxlovid decreased hospitalization and death by 89% if given within 3 days and 88% if given within 5 days. Molnupiravir was less effective at about 30%. But now these are pills that you can take yourself at home. Right now, I've had a bunch of patients who I've had to arrange for monoclonal antibodies for example, and it's a pain. You've got to get them into a place where they can get an intravenous. There's a whole procedure involved. They have to leave their home. Here, think about it. If you have symptoms at the beginning, it's for people who are at high risk of a bad outcome. You can just take it at home, and we're hopefully over time you might even extend this to other populations less at risk.
So you touched on it just a little bit, but who benefits most from this treatment?
You know, right now it's for people who are at high risk for a serious outcome, hospitalization and death, people with underlying conditions, et cetera. But, over time, remember Tamiflu, which you give with flu symptoms, either if you have the flu yourself or if you've been exposed to it. And imagine if it evolved where it was effective and we see that it's safe, that it could be used like that. Right now it'd be just like another bullet, that we can use against this virus.
So, John, it's Vlad. So the FDA has authorized these 2 antiviral pills. When can they be made available to the public?
Well, so far, it looks like there are going to be tens of thousands available before the end of the year. That's now, of the Paxlovid, hundreds of thousands in January, and then tens of millions throughout the year. We're hearing that with Molnupiravir, which is the Merck drug, that millions of them are expected to be available soon. So I got a notice from NYU Langone Health, where I'm a professor of medicine, that Paxlovid was going to be soon available. So I think pretty soon. The problem is going to be, Vlad, is there enough initially to satisfy the need? We're going to have this huge up and down, hopefully down quickly, but we're seeing a big spike in cases now. And by the time we get enough Paxlovid, for example, which seems to be more effective, it may be a little bit past that huge spike where we really need it. But it'll be helpful
John,
later.
Okay. Good to hear. I saw my friend's 4-year-old who turns 5 in 2 weeks, and he's very excited to get the vaccine. He's very disappointed he has not been able to get the vaccine like his older brother has. Kids under the age of 5, not eligible right now. Do we think in 2022 we'll see authorization of a vaccine for kids under 5?
Jamie, we're hoping, but, this is an example of where people should be happy that the FDA is being so careful. The dose for the Pfizer vaccine, for example, is 30 micrograms. The dose for the kids under 5 is 3 micrograms. They're being very careful. And what they found was that there just wasn't enough of an immune response with that dose. They're looking at a third. Moderna is also still recruiting. So fingers crossed that in 2022 you'll see the younger kids get it too.
All right, Dr. Jon LaPook, we have to go, so real quick, what have we learned in 2021 that we can take in 2022 that can hopefully help us get over this hump?
Real quick, what have we learned while standing on one foot? Well, I think we've learned that, it's not, I know it's depressing, right? Here we are, it's another spike, it's another holiday season, but I'm actually cautiously optimistic because one hypothesis is that what could happen right now is we're going to see a big spike up, there's no doubt about that, hopefully with fewer hospitalizations compared to previous versions of the virus, but still you're going to see more hospitalizations, you're going to see deaths, but then hopefully If, the big asterisk, if this does not mutate into a worse variant, we could see it come down. It's going to be a bumpy road, but I'm hoping that we're headed towards the off-ramp. It could be a really rough 6 to 8 weeks. And then after that, it could become endemic. And then drugs like Pfizer's drug and Merck's drug could be really helpful.
Sounds good. Dr. Jon LaPook, thank you so much.